Welcome back to News at Prime. My name is Mateo Khwaripe. Let's get into some business news now. South Africa's largest private healthcare operator, Netcare, reported positive results as operations returned to some normalcy post the coronavirus pandemic. The company's net profit went up by close to 50% to 666 million rand for the half year to end March. The firm says the cost of keeping the lights and its vital machines on during load shedding is rising, with emergency generators costing 3 times more than the normal electricity usage. However, Netcare says the biggest threat to the sector is the acute shortage of nursing staff in the country, which it estimates to be between 26 and 62,000. We're now joined by Netcare CEO Dr. Richard Friedland. Dr. Richard Friedland, just looking at the results under current operating environment, how are you feeling about what you performed during the period?
Good afternoon or good evening, Mateo. Actually, this is probably the best operating performance we've been able to produce since before COVID. So, in truth, we're feeling delighted, particularly in a challenging macroeconomic and hyperinflationary environment, and with the spectre of load shedding hanging over us. So, all in all, it's been an outstanding performance from our teams across the country.
Paid patients are returning by 11% there, but it's still an industry where you have to spend just a little more to get that private healthcare. How is that medical inflation affecting your business firstly, and what can you read from consumers coming into your hospitals?
Well, I think what we're seeing is that the public sector is under growing stress and strain. It's not an alternative at the moment. And so people are holding on to their private health care with everything they can. In order to make it more affordable, many people are actually buying down to cheaper options. We're also seeing an increase in out-of-pocket spend. So despite the fact that disposable income is under pressure, people recognize they can get world-class health care in the private sector. And so we are still seeing very significant increase in demand for private health care, notwithstanding the fact that the economy is on its knees.
And to keep those operations running, you've had to pay quite a bit, pretty penny in fact, to make sure that you have enough diesel to back up the power that you've built in terms of infrastructure. How's that cost affecting the business?
Well, it's a huge impact on the business. Just to give you an example, for the same 6-month period last year, we spent 9 million. In this period, we spent 67 million. And we are budgeting to spend 165 million on diesel this year, generator diesel fuel, versus 36 or 37 million rand last year. So a massive increase of over 120 million, 130 million in diesel costs. We've been very fortunate. Back in 2013, we recognized that government was not going to deliver on its promise of resolving the Eskom crisis, and we began a sustainability program. And so today we have one of the largest solar real estates in the country across 72 of our sites. We're not out there scrambling to buy solar panels or generators or batteries. We've put in all of that capex. But of course the fuel costs a lot of money, and that impacts our bottom line. But at the end of the day, in our sector, the sanctity of life is critical, Mateo, and we've got to keep the lights on 24/7, 365 days of the year. We're not a retailer that can close at 5 and maybe keep the odd fridge on. Every one of our facilities has to keep going 365, 24/7.
And how do you balance then that cost on fuel in terms of spending as a hospital group, but also making sure that you can build other hospitals? Isn't that a spend on fuel then hitting on some of your capex and your plans going forward?
Well, it's really an operational cost at the moment, and it's one, unfortunately, we've got to absorb, because there isn't a medical scheme out there that's actually put their hand up and said, can we offer to cross-subsidize and increase the tariff we're giving you because of the enormous burden you're facing in being able to provide health care? And so the private sector as a whole has had to absorb enormous costs in order to keep the lights on and provide outstanding care. And I hope into next year this may change in terms of the attitude of funders towards the providers of health care. but it's an enormous expense that we are forced to bear at the moment.
It's often a tough decision to make, Richard, in terms of being a hospital and passing on your cost to consumers, but you're spending a lot on this backup power and you're spending a lot on the fuel. Are you going to pass on those costs to consumers soon?
Well, we haven't been able to pass that on at all because we negotiate a fixed tariff with the medical aid funders, and that was negotiated towards the end of last year. And notwithstanding that, it's hardly taken into account the impact of load shedding. And I would dare to say that most South African companies have underestimated the extent to which South Africa has been brought to its knees by load shedding. Fortunately, as I've said, we started preparing in 2013. And so for us, it's less of an issue other than a significant cost. And that's why we've been able to produce the results that we have been. We've been able to focus on our strategic projects, been able to deliver on the tin of what we've said we'd do. But we fully empathize and sympathize with our colleagues out there that are suffering enormously as a result of the lack of power and the inability of government to deliver on a basic necessity.
A hospital group as big as Netcare would need enough staff to run it. You've signaled a different red flag in the industry, saying that there could be a nurse shortage, especially for the private sector, and you'd like to train more.
100%. We're not just a hospital group. We've got 10 other different service offerings across mental health and primary care and cancer and Netcare 911 and a whole number of other divisions. But the reality is we were training 3,500 nurses a year. We've been reduced to training 360 nurses a year by the South African Nursing Council. In fact, the private healthcare sector is only training about 800 nurses at a time when there's a critical shortage. And Mateo, I'll put it this to you. The situation with nurses is akin to the problem we're facing with Eskom. In 1998, government was aware that there was an aging fleet of power transmission across our power generation across the Eskom network, and they needed to replace power stations and nothing was done. Well, I can tell you we have a significant percentage of nurses that will be reaching retirement age by 2030. And unless we meet that shortfall now and train, we're going to have a very significant shortage. And in a country that has probably one of the highest unemployment rates in the world, we have people who are begging to be trained. This is an enormous opportunity for government to allow the private sector to open its doors and start training skilled healthcare workers. Not just for the private sector, and of course I can't speak on behalf of the public sector, but for all of us in creating proper access to healthcare.
You've obviously engaged government on this and the Nursing Council on these particular restrictions. Have they given any fair reason why you can't train anymore? And do they see the danger of not having enough staff?
We've been knocking on government's doors since 2016 when we put forward a proposal to train 50,000 nurses and to fund them as well. Unfortunately, that has met largely on deaf ears. We have got industry approval through NEDLAC, through BUSA, through HASA. The unions are on our side. It's gone to government and the presidency in a public-private growth initiative. But I'm afraid to date there's very little we can show for it. And we want to make sure that we don't face the same crisis that we are with power and the lack of power generation and electricity within our own healthcare sector.
Well, that was the Netcare CEO Dr. Richard Friedland talking about the hospital group's great results that came out today, quite solid, but also a looming crisis in terms of that nursing shortage.